Is your baby struggling with breastfeeding, or is your baby just not gaining enough weight? You might be dealing with something called a tongue tie. Today we're breaking down the 12 most common signs I see in the clinic that could indicate that your baby has a tongue tie. Welcome to Sansefys. My name is Julie and I'm a pediatric physiotherapist. So first of all, what is a tongue tie? A tongue tie is when the small band of tissue that goes from underneath your tongue to the bottom of your mouth is tight. Normally this tissue is flexible and allows your tongue to move freely, going out, going up and to the sides. But when it's restricted, the tongue's movement is limited. And this matters a lot because babies rely heavily on tongue movement for feeding, especially for breastfeeding. When a baby can't move their tongue properly, they may struggle to latch onto the breast correctly, to maintain suction, and to transfer milk effectively. If the mobility and the function of the tongue is limited, the baby may start to compensate with the jaw, chin, and cheek muscles, which leads to muscle tension. In some cases, it's easy to spot a tongue tie. In other cases, it's hard to spot, and parents don't realize there's something wrong before feeding isn't going smoothly. Tongue ties are usually categorized by where the lingual frenulum is attaching to the tip of the tongue and where it connects underneath. They're typically classified as type 1 through 4, where type 1 is the most obvious one and where type 4 is the hardest to see, but can still be very impactful. Type 1. Classical anterior tongue tie. What it looks like. The frenulum attaches very close to the tip of the tongue and attaches in the bottom of the mouth. Tongue shape. The tongue may look heart-shaped when lifted. Feeding impact. Often causes major restriction and noticeable feeding issues. Easy to see? Yes, very visible on oral exam. Type 2. Near anterior tongue tie. What it looks like. Slightly further back than type 1, the frenulum attaches 2 to 4 millimeters behind the tip of the tongue. Tongue shape. May still cause heart shape or reduced lifting. Feeding impact. Can significantly restrict movement, especially lifting or cupping. Easy to see, still usually visible, but requires lifting of the tongue for the full view. Type 3. Mid-tongue posterior tongue tie. What it looks like. The frenulum is thicker and attaches further back on the underside of the tongue. Tongue shape. May not look abnormal at rest, but the movement is still limited. Feeding impact. Often causes hidden feeding challenges like shallow latch, pain, and reflux symptoms. Easy to see, not easily seen unless the tongue is lifted with proper technique. Type 4. Posterior tongue tie. What it looks like. The frenulum is buried in the tissue in the bottom of the mouth and is not visible without deep palpation. Tongue shape. Normal looking tongue at rest. Feeding impact. Can cause serious functional issues even though the tongue tie is invisible to the untrained eye. Easy to see? No. It requires skilled assessment. Important note. The type of tongue tie doesn't always predict severity. A type 4 tongue tie can cause just as many problems as a visible type 1. Because it's also about function, not just appearance of the tongue tie. Let's jump in. Here are the 12 signs you should look for. Number 1. Difficulty latching on. If your baby can't get a deep and comfortable latch, that's a major red flag. They might slip off, go on and off, or seem frustrated. Number 2. Clicking sounds while feeding. Clicking sounds usually mean that your baby is losing suction because they can't seal properly. Number 3. Long feedings or very short ones. Some tongue-tied babies eat for a very long time because they're not effectively transferring the milk. Others give up very quickly because they get super frustrated. Number 4. Poor weight gain. A tongue-tied baby may not transfer enough milk even though they're nursing all the time. If your baby's weight gain is slower than expected, it's definitely worth investigating. Number 5. Gassy or colicky behavior. Struggling to feed often means swallowing too much air. That leaves a baby fuzzy, gassy, and with colicky pain. Number 6. Reflux symptoms. Does your baby spit up a lot? Or does your baby seem uncomfortable after feeding? A tongue tie can lead to reflux symptoms because of the poor swallowing techniques. Number 7. Constant hunger. If your baby seems hungry immediately after nursing, they might not get enough milk. Number 8. Lip blisters or creases. Look closely at your baby's lips. If you see blisters or creases, this might show that your baby is working very hard to keep the latch. Number 9. Urine pain. Breastfeeding should be comfortable once you and your baby get a hang of it. If you're in constant pain, cracked nipples, bleeding, and toe curling pain, a poor latch from tongue tie might be the cause. Number 10. Your baby can't stick their tongue out. Watch your baby's tongue. If they can't stick their tongue out past the gums, move it from side to side, or lift the tongue up of the roof of the mouth, that's a major clue. 11. Sleeping with the mouth open. If your baby can't hold a latch by lifting the tongue up to the roof of the mouth, your baby might sleep with the mouth open. This makes them breathe through the mouth instead of through the nose. Number 12. Heart shape of the tongue. Take a look at your baby's tongue. Does it have a heart shape at the front of the tongue? Or does it have a line on top of the tongue? This is often the tongue tie being very tight and pulling back in the middle and giving this kind of line. Do you recognize any of these signs? Remember, you're not alone and there is help. So, what can you do about a tongue tie? Good news! A tongue tie is treatable, either with exercises or with breastfeeding consultation. If that's not working well enough, you can get something called a frenotomy, which is a cut of the tongue tie. If you suspect that your baby has a tongue tie, talk to a pediatrician, a pediatric physiotherapist, or a breastfeeding consultant. Early diagnosis and early treatment can make a world of difference for you and your baby. If you found this video helpful, please give it a thumbs up, share it with a parent who might need it, and subscribe for more baby tips. And remember, you're doing a great job. See you in the next video.